Hi, my name is David Marsh. I practice general dentistry in Belmont, North Carolina. And for years now, for our more complex procedures, I've worked very closely with Dr. Jameson and Dr. DeLong and Dr. Wright at Gaston in Cleveland, oral surgery. We've had nothing but excellent results with them. When I was first new in town, Dr. DeLong was one of the first ones to reach out to me and sort of get me in the fold to the bigger organized dentistry in Gaston County. So he and I have had a tight relationship since day one. And that was only reinforced by just constant clinical excellence and positive patient reviews. What stands out to me is I think it's just so easy and seamless for patients to go from our office to here to back to our office, and very few things are dropped or skipped before the patient is even brought into the circle. There's so many things that need to be on the exact same page, and so that early communication from even a case-by-case basis, but in general the philosophical cases, of early understanding of each other's standpoints helps us to communicate effectively and seamlessly to the patient. Was a case early on in my time here in Gaston County. Dr. DeLong and I worked together at a full mouth rehab case. The patient was terrified of the prospects of a dentist, much less a big procedure like he ended up getting. And that one guy I'm talking about hadn't seen a dentist for 30 years, and now he skips into our office every 6 months. I'm thrilled about it. The communication is always extremely thorough, right? So we have not just the form letters that come back, we extracted these teeth, thanks for your referral, but it's very tailored and very nuanced for each individual patient and procedure. And depending on the urgency of the communication needs, it could be a text directly to me, could be a phone call to my assistant. These sort of all lines open is a very convenient way to discuss stuff for the benefit of the patient. When I tell patients from there, especially those nervous patients, you have to leave here and go to a whole other office. That's a huge barrier. But when I can reliably promise them, like, you're gonna love it, it's the same vibe, it goes a long way for a lot of patients. I think the most important thing about a referral relationship is that it's a relationship, right? So it's not a transaction. There's a lot more involved than just a tit for tat, right? So especially when we get to these complex cases, and a lot of dentistry is complex.